from a like more global perspective, how do you identify the what? Because that's where you have to start before you transition to the why. So if we could start to like explore that way, and for example, Debbie at Temple, what opportunities led you to decide that AI was the right solution to use? Like, what key factors did you identify that allowed you to choose which technologies to deploy?
So I guess the why of AI. All my peers would probably agree that our job is to seek patient, how to improve patient experience and create efficiencies within our organization. And again, I don't think there's anything magic about what we have the ability to do just installing AI, but the magic and the creativity and the fun comes in when you start to complement other technologies in trying to resolve some of these challenges we have traditionally had. And one example of that is pairing AI with the technologies of PACS, EMR, messaging platforms, and ultimately smartphones. We can take a look at how we creatively combine these things to help with that patient experience, to help with that provider experience, to help create these efficiencies. In the populations that I serve, low margins are always a challenge. So any sort of efficiency we can continue to squeeze from our systems is incredibly important to our survival and sustainability. We in healthcare have very complicated processes, and I think some of the folks who tried to endeavor in this space learned that things in healthcare are very complicated. So we look for ways internally to continue to address process issues and make things more streamlined. And how can we complement some of these processes with AI? And it could be something as simple as helping us consolidate, vast amounts of information and creating executive summaries. We also take a look at the process barriers from growth. A lot of our health systems are in phases of growth, and in the consolidation of these systems, we start to see a lot of process breakdown and a lot of process barriers. So using this technology to help us in scenarios like that, again, in a creative way, I think it helps address the why of AI. And I think one of the other things to the why of AI is the curiosity associated again with our academic entities that we serve, and the desire of those folks to learn and to actually apply the technology in what they do day to day. So it's not only the business challenge or the problems, but it's also the creative minds and the academic minds that we work with. I think one of the things that really resonates with me, Josh, you had talked about taking it slow. And I think that that's probably one of the keys to success with this, in that clinical and transformation of clinical services is incredibly slow to evolve for very good reason. And a lot of our opportunity today lies in that back office space, an area that we can move a lot quicker to solve some of these margin, process, and growth obstacles we're up against.